If you are over 60, I want your full attention right now, because the next 5 minutes could decide whether you walk out of a crisis or never fully recover from it. A stroke does not usually arrive with drama. It arrives quietly, a numb hand, a sudden dizziness, words that won't come out right. And in those moments, most people freeze. They wait. They hope it will pass. That hesitation is often the most dangerous mistake. As a health professional, I've spent years studying what happens in the brain under extreme stress. The brain, when deprived of oxygen or blood flow, enters a state of chaos. But here's the part most people don't know. There's a short window where simple, intentional actions can support blood flow, reduce damage, and buy your brain precious time until medical help arrives. If you suspect a stroke, the first rule is always this: call emergency services immediately. Do not negotiate with yourself. Do not delay. But while help is on the way, what you do with your body matters. Sit or lie down safely, with your head slightly elevated. This reduces pressure in the brain and supports circulation. Now focus on your breathing. Slow, deep breathing through the nose, out through the mouth. Inhale for 4 seconds. Exhale for 6. This is not about relaxation. This is about stabilizing your nervous system. When panic spikes, blood pressure rises. When blood pressure rises abruptly, damage worsens. Calm breathing is a biological intervention. Next, gently move the unaffected limbs. If one arm feels weak, move the other. If one leg feels numb, gently flex the other foot. This light movement encourages circulation without strain. Do not force the weak side. Forcing can increase injury. Gentle awareness is the goal, not effort. Now comes the part that sounds almost too simple, but is rooted in neuroscience. Speak out loud, say your name, say where you are, say today's date if you can. Speech engages multiple regions of the brain simultaneously. It's a way of keeping neural circuits active during a crisis. Silence allows shutdown. Speech encourages connection. If you are with someone, ask them to keep you talking. If you are alone, talk anyway. Your brain does not know the difference. Do not eat or drink anything. Swallowing may be impaired, and aspiration can be deadly. Do not take aspirin unless instructed by emergency services. Different types of strokes require different responses, and guessing can be dangerous. What I want you to understand is this: strokes thrive in chaos, panic, and delay. They do less damage in calm, structured, intentional moments. You are not powerless while you wait. Your body is not betraying you, it is signaling you. We live in a culture that trains us to ignore discomfort, to push through symptoms, to assume everything will resolve on its own. That mindset is especially dangerous after 60. Wisdom at this stage of life is not about toughness. It's about responsiveness. If you remember nothing else, remember this: act fast, stay calm, breathe slowly, keep the brain engaged, and never wait it out. Those 5 minutes are not just time passing, they are time working for you. Your life, your independence, your ability to speak, walk, and recognize the people you love may depend on what you do in that window. And preparation is not fear. Preparation is care. Share this message with someone over 60, not to scare them, but to give them power. Every second matters when it comes to the brain. This is not a dramatic statement. It is a biological reality. When blood flow to the brain is interrupted, brain cells are deprived of oxygen and glucose, the two fuels they cannot survive without. Within moments, those cells begin to malfunction. Within minutes, they begin to die. This is why in medicine we say very plainly that speed is brain. Time lost is brain lost. One of the most dangerous delays happens not because help is unavailable, but because the mind hesitates. People minimize what they feel. They wait to see if the symptoms will pass. They tell themselves they don't want to overreact. That instinct to downplay discomfort is deeply human, but after 60, it becomes especially costly. A stroke often announces itself quietly: a slight weakness, a sudden confusion, a subtle change in speech. The brain is already under threat long before the body fully understands what is happening. From a neurological perspective, delay allows damage to spread. As neurons lose oxygen, they release stress chemicals that disrupt neighboring cells. This creates a cascade effect, where injury expands outward from the initial site. Early medical intervention can interrupt that cascade. Clot-busting medications, blood pressure management, and oxygen support are all time-sensitive. The window for these treatments is narrow, and it closes quickly. Waiting does not preserve safety, it erodes it. What makes this moment so challenging is the brain's own response to crisis. Under threat, the nervous system shifts into survival mode. Fear narrows perception. Decision-making becomes slower and less accurate. This is why preparation matters. When you already know that the correct response is immediate action, you don't have to debate yourself. You simply move. You call for help. You remove choice from the equation and follow a plan. There is also an emotional weight to speed that is often overlooked. Acting quickly is not about alarmism. It is about self-respect. It is an acknowledgement that your ability to speak, walk, remember, and live independently is worth protecting without hesitation. Many people fear being embarrassed by a false alarm more than they fear permanent neurological loss. That imbalance is understandable, but it is dangerous. Emergency systems are designed to respond. Your brain is not designed to wait. Research consistently shows that patients who reach medical care sooner have better outcomes, fewer long-term disabilities, and a greater chance of returning to their previous quality of life. This is not about luck. It is about timing. The brain has a remarkable capacity for recovery when supported early. That capacity shrinks with every passing minute. Speed in this context is an act of compassion toward your future self. It is choosing clarity over denial, action over hope, and care over convenience. When symptoms appear, the decision is not whether it is serious enough. The decision is whether you value your brain enough to protect it immediately. When a medical crisis begins, the body does something very predictable. It floods itself with stress. Adrenaline surges, the heart rate accelerates, breathing becomes shallow, and blood pressure rises. This response is designed to protect us from immediate danger, but during a stroke or suspected stroke, it can quietly amplify harm. The brain, already struggling with compromised blood flow, becomes even more vulnerable under the strain of sudden physiological arousal. This is why calming the nervous system is not an emotional suggestion, it is a medical strategy. The autonomic nervous system governs functions we do not consciously control, including heart rate, blood vessel constriction, and breathing. When panic takes over, the sympathetic branch dominates, tightening blood vessels and driving pressure upward. Elevated blood pressure can worsen bleeding in hemorrhagic strokes and increase damage around a clot in ischemic strokes. In other words, unchecked fear has a physical cost. Calm, by contrast, creates space for stability. One of the most effective ways to influence the nervous system quickly is through the breath. Slow, intentional breathing sends a signal from the body back to the brain that the threat is being managed. Longer exhalations activate the parasympathetic system, which helps lower heart rate and reduce vascular tension. This is not relaxation for comfort. This is a direct intervention that can limit secondary injury while waiting for emergency care. People often underestimate how much control they have in these moments. They believe panic is inevitable, that fear is something that simply happens to them. But the nervous system is responsive. Even under extreme stress, it listens to signals from the body. Choosing to slow the breath, to sit or lie in a stable position, to reduce unnecessary movement, these are choices that change physiology in real time. Calm also improves clarity. When the nervous system is regulated, the brain is better able to communicate symptoms, follow instructions, and remain oriented. This matters when emergency responders arrive. Clear information allows faster, more accurate treatment. A regulated patient is not just more comfortable, they are safer. There is a cultural misconception that calmness in a crisis means passivity or denial. In reality, calm is active engagement. It is the deliberate choice to prevent the stress response from causing additional harm. This is especially important after 60, when blood vessels are more fragile and the margin for error is smaller. What once felt like tolerable stress can now tip the balance toward injury. Training yourself to associate calm with strength changes outcomes. It replaces helplessness with agency. You are no longer waiting in fear, you are participating in your own protection. This mindset aligns the body and brain toward preservation rather than chaos. In moments of neurological threat, the goal is not to suppress emotion, but to guide it. Fear will arise. The task is to prevent fear from driving the physiology. When the nervous system is steadied, the brain has a better chance to endure until help arrives. Calm, in this sense, becomes a bridge between crisis and care, a quiet but powerful form of medicine. In moments of neurological crisis, the instinct to act can become overwhelming. People want to shake the arm that feels weak, stand up to prove they are fine, or force movement in the hope that it will wake the body up. This urge comes from fear, but fear-driven movement can unintentionally increase harm. When the brain is under threat, the body needs intention, not intensity. Stillness, when practiced correctly, is not surrender. It is protection. The brain relies on precise regulation of blood flow. Sudden or forceful movements can cause rapid shifts in blood pressure and increase metabolic demand at a time when the brain cannot meet that demand. After 60, blood vessels are less elastic and more vulnerable to injury. What once felt like harmless effort can now place added stress on already compromised circulation. In these moments, restraint becomes a form of care. Positioning the body with purpose supports the brain without overloading it. Sitting or lying down with the head slightly elevated helps reduce intracranial pressure while maintaining circulation. It allows gravity to work with the body rather than against it. This simple adjustment can make a meaningful difference in how the brain tolerates the crisis while waiting for medical intervention. Movement, when used, should be minimal and deliberate. Gentle motion of the unaffected limbs can help maintain circulation, and preparation is often misunderstood as pessimism, as if thinking ahead invites catastrophe. In reality, preparation is an expression of care. It reflects a deep respect for the fragility and value of human life, especially as we age. After 60, the body changes in ways that are predictable and unavoidable. Blood vessels stiffen, recovery slows, and the margin for error narrows. Pretending otherwise does not protect us. Readiness does. When people avoid preparing for health emergencies, it is rarely because they do not care. More often, it is because the idea feels overwhelming or frightening. There is comfort in believing that serious events happen to other people. This psychological distancing reduces anxiety in the short term, but it increases vulnerability in the long term. Avoidance may soothe the mind, but it leaves the body exposed. Preparation shifts power back to the individual. Knowing the signs of a stroke, understanding when to act, and having a plan in place removes hesitation during critical moments. When the brain is under threat, decision-making capacity is impaired. The more decisions that are already made, the less room there is for doubt. Preparation simplifies action at a time when simplicity is essential. From a neurological perspective, preparedness reduces stress. The brain responds differently to threats it recognizes and understands than to those it perceives as unknown. Familiarity lowers the stress response. Lower stress means more stable blood pressure, clearer thinking, and better cooperation with care. In this way, preparation has direct physiological benefits long before an emergency ever occurs. There is also a moral dimension to preparation that is rarely discussed. Being prepared is not only an act of self-care, it is an act of responsibility toward the people who depend on you. Family members, friends, and caregivers are affected by how quickly and clearly you respond in a crisis. Preparation reduces their burden. It allows them to help rather than panic. Our culture often celebrates resilience as toughness, as the ability to endure without planning or support. In medicine, true resilience looks different. It looks like humility, the recognition that bodies fail and that systems exist to help us when they do. It looks like foresight, the willingness to learn, to rehearse, and to accept guidance. Preparation does not mean living in fear. It means living with intention. It allows you to move through life with greater confidence, knowing that if something unexpected occurs, you are not starting from zero. You have a framework, you have knowledge, you have a response. In moments of crisis, preparation becomes clarity. Clarity becomes speed. Speed protects the brain. What you do before an emergency often matters as much as what you do during one. Readiness transforms uncertainty into action and fear into focus. To prepare is to honor your future self, the person who may one day need you to have taken this moment seriously. Knowledge is not a burden, it is a safeguard. D prevents stiffness without demanding excessive neural coordination. The key is to avoid forcing the side of the body that feels weak or unresponsive. That weakness is not a sign of laziness or resistance. It is a signal of disrupted neural communication. Forcing movement through a damaged pathway can increase strain and worsen injury. There is also an important psychological component to purposeful stillness. When people stop trying to fix the problem through frantic action, they create space for observation. They become more aware of changes in sensation, speech, or vision. This awareness is valuable information for emergency responders. It allows for clearer communication and faster decision-making once help arrives. Our culture often equates action with strength and stillness with helplessness. In medicine, the opposite is frequently true. Precision outperforms force. Thoughtful restraint preserves function. The most effective response is not the loudest or most dramatic one, but the one that respects the limits of a stressed system. Learning to tolerate stillness during a crisis requires trust in the body and in the process of care. It is acknowledging that the brain, when injured, needs support rather than challenge. Purposeful stillness conserves energy, stabilizes physiology, and reduces the risk of secondary damage. In these moments, the goal is not to test what the body can do, but to protect what it still has. Gentle positioning, minimal strain, and intentional movement create an environment where the brain has the best possible chance to endure until professional care takes over. That restraint is not weakness. It is wisdom applied under pressure. When the brain is under threat, one of the greatest dangers is silence. Silence allows systems to shut down quietly without resistance. Engagement, by contrast, keeps neural networks active and connected. In moments of neurological crisis, staying mentally present is not just reassuring, it is protective. Awareness becomes a way of keeping the brain online when it is at risk of disconnection. Speech is one of the most powerful tools the brain has. It is a complex process that requires coordination across multiple regions responsible for language, memory, motor control, and auditory processing. When you speak, you are activating a wide network of neurons simultaneously. Even simple words demand cooperation between different parts of the brain. This widespread activation can help preserve function during a crisis by encouraging communication between circuits that might otherwise go quiet. This is why saying your name, where you are, or what day it is matters. These are not meaningless phrases. They are anchors of orientation. Orientation stabilizes the brain by reinforcing its sense of place, time, and identity. When orientation is lost, confusion deepens and panic follows. When orientation is maintained, the brain has a reference point from which to operate. Talking also serves an emotional purpose that directly affects physiology. When people speak out loud, they slow their breathing and regulate their heart rate. The rhythm of speech naturally encourages a steadier respiratory pattern, which in turn calms the nervous system. This creates a feedback loop where mental engagement supports physical stability, and physical stability supports mental clarity. If someone else is present, asking them to keep you talking is a form of shared regulation. Conversation, even one-sided, keeps attention focused outward rather than collapsing inward into fear. If no one is there, speaking aloud still matters. The brain responds to self-generated speech as strongly as it does to conversation. The act itself is what counts. There is a misconception that rest during a crisis means mental withdrawal. In reality, gentle cognitive engagement is a form of rest for the injured brain because it discourages chaotic firing patterns. Structured thought, names, dates, simple descriptions, creates order. Order reduces stress. Reduced stress protects vulnerable tissue. This approach also has practical benefits once help arrives. A person who has remained engaged is often better able to communicate symptoms, respond to questions, and cooperate with care. This can speed diagnosis and treatment. Engagement does not guarantee recovery, but it increases the chances that care will be timely and accurate. Staying mentally present during a neurological emergency is not about denying fear or forcing optimism. Fear will be there. The goal is to prevent fear from pulling the brain into isolation. Engagement keeps the lines of communication open, within the brain and with the outside world. In these moments, awareness is an act of resistance. Speech is an assertion that the brain is still working, still connected, still worthy of protection. By staying engaged, you give the brain the best possible environment to endure until medical care takes over.